I shouldn't have been at high risk, and I got it. I got a severe case. So it could happen to anybody.
Kathy Novak had one of BC's early cases of COVID-19. During the first weekend of March, she was at a dental conference in Vancouver. 2 weeks later, she was on her way to the hospital.
So what was that like when you got in the back of the ambulance?
Well, the whole thing was really scary because, again, I thought there's really no cure for this. So at that point, I was feeling a bit hopeless that I don't know if I'm coming back home. Sorry. Or in what capacity? Like, is my brain going to be working, or, what's going to be? So that was scary.
A few hours after being admitted, her husband called to try and get an update. The 60-year-old was already in the ICU on a ventilator.
That was when the doctor told me if we'd waited any longer, even one more day, she might not have made it. Might not even have been able to get her on the ventilator. It was awful. You don't realize how much you miss someone until it actually happens, and you don't know if you're going to see them again.
That dental conference, attended by 15,000, was eventually connected to more than 80 cases and at least one death. But even before that was on public health's radar, BC appeared poised to be hit particularly hard by the global pandemic. Its airport is a hub for flights to and from Asia. And by late January, there were multiple outbreaks to the south in Washington state. COVID-19 arrived in BC soon after.
Late yesterday, we had our first case of a novel coronavirus.
BC recorded the first death in Canada after an outbreak at the Lynn Valley Care Centre in early March. It was what Dr. Bonnie Henry, the province's health officer, feared.
Excuse me.
Just take a moment.
And it left her shaken.
I'm very concerned about I went through SARS. I've been through Ebola. I've been through the pandemic in 2009. And I just know how stressful it is for our healthcare system, for my colleagues, and for families that are dealing with this.
But what has emerged is that BC's death rate is among the lowest when compared to many other large jurisdictions across North America and Western Europe. It's substantially less than Ontario and Quebec. And some health experts believe it's a combination of good fortune and sound decisions.
I think a lot of what we did early on was very helpful. Part of it was timing, part of it was luck, part of it was people really embracing what we needed to do and doing it together.
By timing, she means March break. Quebec had its holiday earlier, so people traveled and came back home. By the time schools were out in BC, provincial and federal health officials were already advising against international travel. At that point, BC was preparing for the worst. It was bringing in millions of pieces of PPE, including by chartered flights from China. The Vancouver Convention Centre was turned into an overflow hospital, but today it sits empty. Of all of the discussion around BC's handling of the pandemic, much of the focus has been on its management of long-term care facilities.
Initially, there was some fear experienced by the staff, by the residents and families there.
In the Vancouver area, Dr. Michael Schwant led the response team on the ground, beginning at the Lynn Valley Care Centre. He said at first they were testing care home residents who had typical COVID symptoms like fever and cough, but that changed.
By mid-March, we were looking for a very broad array of symptoms, testing for those, and in many cases finding cases who might have flown below the radar otherwise.
Still, in the weeks that followed, there were several new outbreaks at other homes. On March 27th, the government ordered staff to work at only one facility, but the move took time to implement. It was just last week that all of the nearly 9,000 workers who did shifts at multiple homes were assigned to a single site.
This is where clearly public health expertise was brought to bear in a way that it was not in Ontario.
Ontario didn't follow suit with its care homes until 3 weeks after BC first made its announcement. And Colin Furness, an infection control epidemiologist, says that's not the only difference.
If I could put us in a time machine and I could send Ontario back to early March, I would have an effective expert owning the podium and doing that communication.
By that he means because while Premier Doug Ford handled the updates there in BC, it was Dr. Bonnie Henry. Furness believes her vast experience instilled credibility.
And this is a very sneaky virus.
But even though BC may have avoided the worst of it, Henry says it's still not time to take a breath. There are still active outbreaks in care homes and more than 165 people have died.
Is there anything that you would do differently?
Yeah, I think about that. I think we can never get it perfectly right, but it's really hard to think about looking back right now. We still have a lot of ways to go before we're out of this crisis.
I almost died.
Back on Vancouver Island, Kathy Novak is still recovering. She spent nearly 2 weeks on a ventilator and a month in the hospital.
I did a lot of reflecting and feeling lucky, to be alive.
She's still fatigued but has slowly been regaining her strength. The virus caused a bright red rash to break out over her body. It's gradually fading, but the anxiety isn't.
I'm still nervous about it. I'm nervous about people putting their guard down and being a little more careless. And because even though hopefully I'll never get it again, but there are other people that you could pass it on to. So that's still a danger.
She doesn't know if her husband ever got it, so even though health officials say they can now expand their bubble and have contact with more people, they're sticking as a party of two, which they're grateful for, considering how close they came to losing that. Briar Stewart, CBC News, Victoria.